I'm Deborah Thomas.
And I'm Dr. Robert Kennevan from the Avalon Clinic. And today we're going to be talking about planning your procedure. And before we start, I just wanted to cover something, a home alone situation that I heard in the news. So as I was coming in, I heard the news that Michael Jackson's children, one of his children, had ordered a taser and was chasing the other kids with it. And I was thinking that's a good example of what not to do when you're having your kids being cared for at home.
It's funny.
Yeah. Anyway, Deborah, when someone has decided to have surgery, what are the things that they need to do once they've made that decision to go ahead and have cosmetic surgery?
Okay. Well, one of the things definitely is to choose a surgery date that will work for you. That may entail taking time off from work, speaking with your employer, making sure that works for you. Also scheduling a pre-op date or preoperative date, and we generally do that 2 weeks before surgery, 1 to 2 weeks before surgery. And then also choosing a great support system, a good caregiver with that.
Good. So you said the first thing they have to do is choose a specific surgery date.
Yes.
So how do they go about doing that?
Well, in the consultation, your consultant, once the doctor leaves, will go over a price quote with you and also bring in a calendar of available surgery dates. And that's kind of, helping you choose what day will work for you to do
Good.
surgery.
Okay, and you said they also need to plan time off.
Yes.
So when, I know this is something that you do with them frequently, help them through these steps. How do they plan adequate time off?
Well, it really depends on the procedure that you choose. For example, for breast augmentation, you will need about 5 to 7 days off from work.
So they need to know how much.
Yes.
And then they plan that time accordingly. Okay. And the next thing you said is that they need to do a preoperative visit.
Yes.
Why don't you explain what's involved in a preoperative visit?
Okay. Well, the way I explain the preoperative visit is it's kind of like a mini physical. You will meet with the nurse, and during that time you will sign consent forms, your permission for surgery. We'll also give you a prescription, and you have a chance to try on implants if you choose breast augmentation. This would be your final fitting for that. You also take care of the remaining balance of your surgery, and the nurse will answer any of your questions. There may also be some lab work involved or an EKG, depending on your age, and that's about it.
How long, Deborah, does a preoperative visit, how long do you schedule that for? How long do they need to plan to be there?
About an hour and a half.
So it takes a long time.
Yes.
Yeah.
It's an important appointment.
Okay, great.
Yeah.
One of the things you mentioned is that they need to get a support person. So would you like to explain what a support person is, what you look for in a support person, and what's involved?
Okay. Well, a support person is someone that can support you during the recovery. The support person will bring you to the clinic the day of the procedure, so drive you to the clinic and also home. The support person will stay with you the first 24 hours and assist you any way that they can, meaning assisting you to the restroom, with meals, and any other areas that you need help with. It's someone that is an adult, at least 18 years old, and someone that you trust and is able to support you.
You had asked me to talk about the preparing, so there were certain things that they couldn't do, and they're like, we want them off aspirin and off fish oils. And of course, if they smoke, we want them to stop that. Would you like to just summarize, Deborah, what you would say were the key things to remember from this little video?
Okay. The key things I would say is, of course, have a good support system. Also, choose a surgery date that will work for you. You may have to work out some things such as time off. If you have small children, you want to make sure that you have someone to take care of your kids for a few days if necessary. And also, like Dr. Kennevan said, make sure that you are off of aspirin type medications, and just make sure that this is right for you.
Good. And thank you as always.
Thank you.
Thank you.